Hello and welcome. In this video, we will talk about safety precautions to be taken when a patient with HIV comes to the labor room. HIV is primarily transmitted through blood and body fluids that contain a high concentration of the virus. During childbirth, large amounts of body fluids can be splashed in the labor room and onto healthcare providers. For that reason, patients who are pregnant with HIV have to be looked after by staff who understand that they have to take a comprehensive approach to ensure both the mother and the baby's safety. At the same time, the safety of the healthcare providers is also very critical and very important. The most important aspect of care is infection control, and for this, the basic process of ensuring proper hand hygiene is critical. Staff should use appropriate personal protective equipment such as gloves, gowns, masks, and eye protection to prevent the transmission of the virus. Follow standard precautions and transmission-based precautions if there is a risk of exposure to blood or other bodily fluids. Most hospitals will have some kind of a protocol for reporting and for treating a healthcare provider who has been exposed to the virus. Follow these protocols and these processes. And if you don't have these protocols, then make sure that the administration understands the importance of having these protocols into place and having the safety precautions in place. Patients need to have antiretroviral therapy for HIV, especially in those conditions where the HIV viral load is high, or if the patient has been admitted with a new diagnosis of HIV. And for this, the infectious disease staff and the infectious disease physician have to be involved, and they will be responsible to ensure that the proper dosage and the proper drug is being administered to the patient. The mode of delivery will be highly subjective to the presence of the mother's viral load. And if the viral load is well controlled and low, then there is a possibility that the patient may have a normal delivery. However, cesarean section is indicated if the viral load is high or if there are any other medical or obstetrical indications. As far as the timing of delivery is concerned, you have to coordinate with your team to plan the timing of the delivery to minimize the risk of transmission while considering the mother and baby's health. Avoid premature induction or delivery unless medically necessary. So the timing of delivery will depend a lot on whether the delivery is being planned electively or whether the delivery takes place as an emergency, because the patient may present with different kinds of situations. For example, she may present with spontaneous onset of labor or with spontaneous rupture of membranes either prematurely or at term, or she may present for an elective cesarean section, or she may present for an elective induction of labor or augmentation of labor subsequent to spontaneous rupture of membranes, or she may even present with premature labor. So in all these situations, the timing of delivery has to be coordinated with the team members and all the precautions must be in place. When the patient is registered in the antenatal period and is HIV positive, irrespective of the viral load, the pediatricians have to be involved. And in case the patient presents in the labor room and she, for the first time, then there's an urgent need for contacting the pediatrician and the neonatologist so that all the relevant information has been transferred for the best possible situation for the baby to be born and for the least risk of neonatal transmission. The question of breastfeeding is a little bit tricky because in settings where safe alternatives to breastfeeding are available, you can advise against breastfeeding to prevent transmission through breast milk. But if breastfeeding is the only option available, then weigh the risks and the benefits carefully and provide appropriate counseling and support. As part of the safety precautions, it is very critical that in all high-risk cases, the team communication must be absolutely 100%. As many people are going to be, and many physicians are going to be involved in the management of this team, which will include nurses, technicians, physicians, obstetrician, neonatologists, infectious disease specialists. It's important that the relevant information is provided well in time to make sure that correct decisions can be made for the patient and for the newborn. Patient needs to be educated, and therefore thorough counseling of the pregnant woman and her husband is absolutely important. In some cases, there may be immediate family members who are the primary carers and primary healthcare providers, and with the consent of the patient and with the consent of the husband, then these can also be involved for the care of the mother and for the care of the newborn. And the information that has to be transmitted is the HIV status, the risks of transmission, and the importance of medication adherence. It is also important to start planning for postpartum contraception as early as possible with the consent of the family members and with the information to the family members, so that the patient and her subsequent children can have a reduced risk of infection. Post-exposure prophylaxis for healthcare workers has already been explained that in the event of accidental exposure to the mother's blood or the bodily fluids, you must ensure that healthcare workers have access to post-exposure prophylaxis as appropriate. The patient's notes must be kept confidential, and generally in such situations, the patient's medical record is not kept with the medical records of all the other patients in the labor room, and it is kept separately. There should also be a clear sticker which is present on the patient's file that this is a confidential report and that it must be kept carefully, and you must make sure that only authorized personnel have access to the patient's medical information. So to summarize, it is important that patient care has to be according to the patient's needs and according to the local guidelines, and also to all the resources that are available within that facility where the patient is being given care. The resources include the presence of the relevant physicians, the nurses, the administrative staff, and the communication with the National AIDS Program, the presence of medication, and the readiness of the staff to ensure infection control principles can be applied to the patient's care. So the goal is to provide comprehensive care that addresses the medical needs of the mother while minimizing the risk of HIV transmission to the newborn and to the healthcare providers. If you like this video, then please press the subscribe button, press the like button also, comment and share, and also press the bell icon to be notified of future publications. Thank you for watching this video, and goodbye.